Let's start with energy. Energy, calories, any form is calories. Good calories are vegetables and fruits and protein and meat and eggs. Bad calories are sugar, ice cream, chocolate. Everything you eat, your baby will eat from the very beginning. So you have to make sure the baby eats healthy, so you eat healthy. As far as protein, you need an extra 70 grams of protein per day. Protein is needed for the baby to develop tissue, to develop bone, to develop brain cells, and protein also helps the development of placenta and muscles for the baby. So protein is very important, and 70 grams is about 6 to 9 servings. A serving is about what fits in the palm of your hand. So 6 to 9 of these, and sources of protein are eggs, chicken, tuna, beans, nuts. Then we move on to calcium. Calcium is needed for the formation of bones for the baby, and you need about 1,000 milligrams per day of calcium. And sources of calcium are yogurt, milk, cheese, and some calcium fortified foods like orange juice are great for sources of calcium. Broccoli is also a good source of calcium. Iron is another nutrient that you're going to need when you're pregnant, and it's actually the only nutrient that you cannot eat enough of on your own. So most women have to take the iron supplements in forms of pills, but you need to consume about 27 milligrams of iron a day. And foods that contain iron are usually animal products, so fish, meat, chicken, pork, and beans. And if you are a vegetarian, it is important that you eat enough beans, and actually if you add a little bit of lemon juice or lime juice either to the beans or to what it is that you're drinking when you eat, you will absorb the iron better. Folic acid is the next one. It's very important. Folic acid helps in the prevention of spina bifida and in the formation of neural tubes in the baby. And folic acid, you find it in dark green leafy vegetables. So anything like kale, spinach, green beans, broccoli, any of those vegetables are good sources of folic acid. You need about 600 milligrams of folic acid a day. As far as vitamin C, it's important to keep yourself healthy and so you can have a healthy baby and a healthy pregnancy. Vitamin C comes in fruits and in vegetables. The rule is usually the citrus have a little more vitamin C, however strawberries are very high in vitamin C also. Water is very important to consume water. It helps with the digestion of all the foods that you take. It also helps in the avoiding constipation. And you need to drink about 8 glasses of water a day. And a glass is about 8 ounces, so about this much, or what fits in a cup of yogurt. That would be about an 8-ounce cup. So 8 ounces, 8 times a day for water. It's important to remember to reduce, if you can, canned products, because they tend to have a lot of sodium. And if you eat a lot of sodium, you will retain water, and then you will have swelling problems. And in pregnancy, you already will have some of those problems, not related to food, but just related to pregnancy. Other things that are very important, and as far as when you eat fiber, try to choose foods that have whole grains in them. So for example, here's whole grain brown rice, and this has the husk, and this is what helps this is the fiber that helps your digestion be better. And when you increase your fiber content, it is important to increase your water content. Exercise is a wonderful way of also keeping yourself healthy, keeping your baby healthy, and avoiding constipation, which is a very normal part of being pregnant. Decreasing your caffeine intake, your fat intake, your sugar intake, your alcohol intake are all also healthy ways of maintaining your pregnancy and making sure you have a healthy baby, and trying to get as much rest as possible is also a good way. So remember, what you eat is what your baby gets. So eat healthy, your baby will be healthy, you stay healthy. And if you're planning to breastfeed, which hopefully you will, this diet is what you want to keep also when you're breastfeeding. So your baby gets all this through your placenta when you're pregnant and through your breast milk when you're breastfeeding. Thank you.
Hello. You know, once you have your baby, you still have a very important time of healing, and that's called postpartum. Some of us call it the 4th trimester, and it's a very important part of your pregnancy. And sometimes it can be the most challenging part of your pregnancy. It's very important that you keep yourself clean. Shower every day. And if you've had a cesarean, make sure that you dry that wound off and keep it clean and dry.
And make sure that you change to clean underwear every day also.
Your bleeding will go from red to pink to tan, and it may last as long as 3 to 4 weeks. If you've gone to tan and it goes back to a bright red color, it probably means you're doing too much. If this continues for more than a day, call your doctor. First, lay down, get some rest. You really do need a lot of rest during the postpartum period because you're not getting a lot of sleep because your baby is going to be demanding and having you up every 2 to 3 hours possibly.
So sleep when your baby sleeps. Take the phone off the hook, turn off the ringer. Make sure that all you do in the first couple of weeks after your baby is born is eat, sleep, and nurse.
And I actually tell a lot of my moms to wear a bathrobe for the first 2 weeks and maybe keep an old mascara in the pocket. And when someone comes over, smear that mascara on your face and you're going to look pretty bad and they're going to feel sorry for you and they might even clean your house for you. So leave that vacuum cleaner off and dust it off once a week whether it needs it or not. Another very important part of your healing process is you remember not to have anything in your vagina for 6 weeks. That includes tampons, and that also means no sex. It's very important that you not do this so that you don't get an infection.
And make sure that if you run fever over 100 degrees that you contact your physician right away.
And keep that appointment at 6 weeks with your physician. It's very important. But remember, there's lots of us out here that are here to help you, and we want to help you, and we want you to enjoy this time period as you get to know your baby.
I'm Terry Giles, and I'm the Executive Director of North River Care Pregnancy Center in Palmetto. And one of the things that we're going to talk about today is postpartum care for the mom and for the baby. One of the most important things that you've already learned about is your mental health and how you feel. A way to help that is to become active as soon as you have your baby. You're happy, you've had the baby, you need to get up and start moving as soon as possible. So whenever you've had the baby and you're all cleaned up and you got on a fresh gown and some fresh sheets, the first thing you need to do is find out if you can get up and go to the bathroom and take care of yourself. When you get up, you need to make sure you take care of the baby also, and that keeps you moving a little bit. So one of the first things that you need to do for the baby is take care of the umbilical cord. Every time that you change a diaper, you need to take care of the cord. And in your little isolette that your baby's going to be on, you're going to have some alcohol swabs and you're going to have some pads. This is what you're going to use as a wipe. For the first couple of weeks, you need to use just the wipes because there's no alcohol, no fragrance or anything else. So go to your sink, get them nice and warm. Use 2 or 3, there's plenty of them in there, so just use as many as you need. And you need to, on your umbilical cord, you need to get your wipe out. You can touch it, it won't hurt you. What we suggest at North River Care is that you wash your hands before you change the diaper and after you change the diaper. Take it and move it to the side and get it nice and wet around it. And then just wave it dry. What the alcohol does is help dry up that cord. And then when you change the diaper, you want to use plenty of these. Now the first bowel movements are a little sticky. So instead of scrubbing them, remember that skin has never been touched. So you want to wet it down so it comes off easily. So touch it on there, get the biggest chunks out, and then wipe it off very carefully. If you have a little boy, the next thing you want to do, if you've had the baby circumcised, you want to go ahead and get a gauze pad. They'll have some tubes of petroleum jelly. At home, you need to get the little tube. It's easier and it's cleaner to not have to stick your finger in it, and just squeeze a little dab on the top, put it on the top of the circumcision, put your clean diaper on, And then when you put your diaper on your baby, you want to make sure that you turn it down. There are diapers that you can buy that have the holes cut out. Sometimes they're hard to find. So if you use a regular diaper, just put the diaper on, turn it down, and tuck it underneath. It's very, very important that you don't let the diaper get the umbilical cord wet, because the purpose of the alcohol is to dry it out. If the diaper's on it wet, then it just keeps it wet. Some of the things to remember to tell your doctor: if it starts smelling, if it gets hot or red, or if it starts oozing. That usually means that it's just not quite as dry as it needs to be, so you need to take care of it. But please, please call your Healthy Start coordinator and ask them if you have a question. Call your doctor if you have a question. Just pay very close attention. Usually within 7 to 10 days, the umbilical cord has fallen off. That'll be after you get home from the hospital. Now, once you get home, after a couple weeks, you can begin to use wipes. You want to be careful how you bathe your baby. Don't use a lot of soap until the baby's able to get into the bathtub, where you can rinse him off or her off very, very thoroughly. And another thing to help with postpartum care is to take care of yourself. Sometimes once you get home, there's not a lot of activity around you. You're home by yourself because dad has gone back to work or mom has gone back to work. You're not seeing a lot of people. So the good thing to do is put the baby in the stroller and take the baby for a walk. Get yourself out, get some fresh air. But overall, please, please remember that if you ever have any questions, please feel free to call your Healthy Start coordinator. They would love to help you, and they're always available.
Hi Katie, today we're going to talk about bonding with your baby. Do you know that bonding actually starts during the pregnancy? After about the 4th month, the baby can feel actually your touch, listens to sounds, and knows the voice, knows your voice. And so during the pregnancy, it is important to talk to your baby, rub your tummy a little bit, let that baby know that he or she is going to be welcomed into your family. After the baby's born, talking to your baby, looking eye to eye with your baby. Little babies love to mimic and imitate the faces and their mothers. So by making funny faces, sticking your tongue out will encourage the baby to communicate with you and attach. Another way of helping the baby to feel close to you is through infant massage. And babies, some babies, not all babies, but many love to be touched. A little gentle rub on the tummy will help them to pass some of that gas that gives them such a bellyache. Also, turning them over, rubbing their back, the skin-to-skin contact helps that baby to feel your touch, to feel secure and loved. Another way that you can massage your baby is by doing some gentle exercises. Toe to finger, back and forth. This lets the baby know that he's loved and that he's secure in your arms. So bonding with your baby starts while you're pregnant and continues on through life. And this type of activity helps your baby to develop into a caring, responsible, loving adult. So today, I've given you a few points on how to attach to your baby. And if you'd like more information or have any questions, don't hesitate to call your Healthy Start Coalition of Manatee County. We're there to help you and your baby have a happy and healthy life.
Hello, my name is Katie Powers, and I'm a lactation consultant at Manatee Memorial Hospital.
And I'm Leslie Thyler, lactation counselor at Lakewood Ranch Medical Center.
And we're going to be talking to you about breastfeeding, a very important way of feeding your baby to make sure that your baby is healthy and you are healthy as well.
I'd like to start out by telling you about the benefits of breastfeeding. The benefits for your baby are that probably your baby will get sick less often. There's decreased illness for babies because of all the antibodies and immunities that are in your breast milk. Your breast milk is specifically made for your baby. to help keep your baby healthy. Your breast milk changes as your baby grows to meet your baby's needs. The benefits for mother are that it, of course, is cost saving. There's no cost to breastfeeding, like there might be with formula, or if your baby gets sick often because they're not breastfeeding, then there are a lot of trips to the pediatrician's office and maybe missed time at work. Your breast milk is always ready for your baby. It is clean, fresh, and the right temperature. It's really like fast food at 2 convenient locations. It's right there and ready for you all the time. Another benefit for mother with breastfeeding is that it helps to control the bleeding after your baby is born by promoting contractions of your uterus. And when you're 3 to 12 months postpartum, if you're still nursing your baby, then there is an increased rate of weight loss. Now, some of the things that will help you get started breastfeeding that are important for you to know are for you to keep your baby skin to skin with you as much as possible. Hold your baby as much as you possibly can in the hospital. Also, your baby will demand to eat when it wants to eat. Your baby will determine how much milk your baby will need by how often and how long the baby nurses. Nursing the baby early and often in the first couple days is very, very important. The latch for the baby is important too. You want to get as much breast in the baby's mouth as you can. It's not nipple feeding, it's breastfeeding. So you want to make sure that the baby's mouth is open wide, and again that you get as much of the dark area around your nipple in the baby's mouth as you possibly can when you first start. There are different positions that you can hold your baby in when you start breastfeeding. One of them is the cradle hold, as Katie holds her baby here in front of her. You always want to be sure that the baby is facing you, and there's somewhat of a line from the baby's ear to the shoulder to the ankle, so the baby's in a straight line facing you always. Another position you can hold your baby in is called the football hold, like tucking a football under your arm. This is a really good position to start breastfeeding in. It's very comfortable for mom and for the baby and helps to promote a really good latch to start out. Remember, your baby cannot get too much breast milk. The way that you can tell if your baby is getting enough milk is by checking the baby's wet and dirty diapers. The first day the baby should have 1 wet diaper, the second day 2, and 3 or more from the 3rd day on. Usually the 3rd day your milk comes in, the second milk that changes from the colostrum, and then you'll notice more wet and more dirty diapers. Anything that goes into the baby needs to come out, just like it does with adults. So the way that you tell if your baby gets enough is by the wet and dirty diapers. The important thing for you to remember, the most important thing that you're going to need to make your breastfeeding experience successful, is to seek help and support. There is help and support all over this area, and you'll be provided with phone numbers at the end of this DVD.
And this is a very special time because those first few weeks after you have your baby is a time for healing for you and a time for your baby to get to know you. And so you're going to need to spend a lot of time together. If you have a lot of visitors, it's okay to ask them to leave so that you can have this special time with your baby. And so to wrap up on breastfeeding, I want you to remember just a few things. First of all you need is breast milk for your baby. Your body will make the milk as your baby needs it. The other thing, feed early and often. Sometimes it may seem like that's all you're doing all day is feeding your baby, but that's okay, because you're not just feeding your baby's stomach, you're feeding your baby's senses as well. Remember, we measure intake by looking at output, just like we do for you. If you drink water, you pee. If you don't drink enough water, you don't pee. And your baby needs to be peeing, okay? And you drink when you're thirsty, and you typically get really thirsty when you're nursing. So when you sit down to nurse your baby, make sure you have a glass of water. That's all you need. You don't need anything fancy. And when you nurse your baby, this is really important, your uterus shrinks. So you graciously allowed your baby to make your uterus big. Remember? Now it's going to be payback time, and it's time for your baby to make that uterus small. Because every time your baby nurses, your uterus is shrinking. And probably one of the most important things is it's free. You don't have to pay for bottles, nipples, buy formula. It's free, and it's always there and perfect for you and for your baby. And remember, you want to make sure it's fun, not frustrating. If you're frustrated and your baby's frustrated, give your baby to someone else. Let them calm the baby down because you want this to be a fun experience.
You have a beautiful baby. My name is Kim Janacro. I'm the child safety educator at Manatee Memorial, and I teach all of the infant CPR and car seat safety classes. I'm the nurse that does all of the safety instruction. So today we're going to talk about how to keep your baby safe. Keeping babies safe is all about prevention. Always staying a step ahead of your child. It's all about prevention when it comes to the safety of your child. In a car, obviously car seats are a necessity. Every single time you are in a moving vehicle, your child has to be in a car seat. Don't ever think for 1 minute it's okay to hold your child in your lap, even if it's just around the corner, because then you never know when someone can be, out there driving recklessly and drive into you. Even though you could be driving safely, someone can hit you, and then of course that could be a deadly, result. So every single time you are in a moving vehicle, your child has to be in a car seat. Your car seat is great because it's an infant carrier seat for infants only. However, there are certain height and weight limits. So once your child hits those certain limits on the seat that you have to make sure you graduate them to the next level, which would be a convertible car seat. A convertible car seat means it's a car seat that converts from a rear facing to a forward facing. And that's usually, those car seats, some of them start from 5 to 40 pounds, but you can use your infant carrier up until the weight limit on this particular seat, and then you can graduate them into a convertible car seat. You want to keep your child rear facing until as long as your convertible car seat's height and weight limit states on the seat that you choose. So if it states, for example, keep child rear facing until 30 pounds, that's how long you will keep your child rear facing. It used to be 20 pounds in first birthday. That's old literature. The new recommendations are keeping them rear facing until your car seat recommends. And it will state, keep them rear facing until such and such a height, such and such a weight, and then they can go forward facing. While they're rear facing, like now, you can see how his head's a little bit tilted. In your vehicle, you want to make sure that your child is at a 45-degree recline. So either your base will have the ability to adjust and recline him, if your base does not have that ability. So what you can use, which is safety tested and approved, are using pool noodles. You tuck pool noodles on the under part of your base in your vehicle, and then we can secure the base into the car. And then what that does is it just reclines your baby at a 45-degree recline while you're traveling. It'll help to straighten out his head, and also it helps to keep his airway open, okay? Because if he's sitting up too far, if your base is in too straight and he's sitting up too high, his little head can flop forward, and of course then that's going to block off his airway, and that's not a good thing. Do not add anything to your car seat. It's called non-regulated products. Never add something to your seat that did not come with your seat, has not been safety tested for your seat. What you can do while he's very small is you can take a receiving blanket and you can roll it up. And what you can do is just actually tuck this to the side. Again, making sure it's not a suffocation hazard, but what you can do is see how his little head is kind of tucked? You can kind of just tuck it in, down along the side, behind his shoulder.